best practice in PBCS templates.
Good afternoon, everyone. Scared of using a microphone after the last karaoke experience, or everybody else says at least. My name's Irfan Mazhar, or Arfan Mazhar in English, and I'm going to be talking to you about the best practice on templating for PBCS. And the best part, a little bit about me, some bragging. There's a lot of people that I don't know in this room, so I just want to give you a bit of credentials about me. So I've been working within Oracle and Hyperion space for at least 12 years. Worked on multiple planning and SPS projects, mainly around kind of PBCS lately. And I've worked in various kind of industries and held roles from doing project accounting, working on end client as administrator, developer, manager, few years in consultancy, and now I'm independently contracting. And my main kind of expertise and experience is around Hyperion planning, SBS, PBCS, FDM, but I've covered sort of some of the other applications. And some of the companies that I've actually worked for that you might be familiar with. And then I had a box to fill, so I thought I'd just put in that it's best when somebody else has something good to say about you too. So that's just a little bit about me. And what I wanted to cover today in this session was really talking about best practice template. And what I mean about that is actually understanding a particular market or sector well enough to be able to create a best practice template that can reduce the deployment time and reduce the effort that you kind of implement in there. So I know that we've already got ePBCS templates available. Is there anybody implemented them in this room? Is there any deployments of ePBCS templates? I mean, it's a good starting point, but I find that a lot of places, especially the latest work that I've been doing around public sector, it doesn't seem to fit, right? So there's always been kind of a custom application built around that. And so what I'm going to focus on in the next 10, 15 minutes is around how you can deploy a full complex ePBCS or PBCS application in 30 days or less, right, end to end. And I've kind of proven this around public sector, especially NHS and local government. The use case I'm going to use for this is the starting projects that we did for Calderdale and Huddersfield NHS Trust. And then we worked with Yorkshire Ambulance Service. So both of those places actually had, the requirements were exactly the same, but they just had different ways of doing it. So they had these complex offline spreadsheets that they're working on, working in different ways, but trying to achieve the same thing. And the similarities between them was that they had the same chart of accounts, right? So they've all got account structures, sub-account structures, cost center structures, and the rest of it was pretty much the same. And they all needed income and pay models that fed into a central forecasting and budgeting model. And they all looked at their actuals, budget, forecast, and what's different in public sector to most other private organizations is a thing called virements, which is budget transfers. So they're moving money about, the budget allocation that each department's got, they kind of move that about, and they need to keep an audit log of that. And they also had the same kind of challenges. So something like incremental drift, which is actually just the employee's start date, the anniversary of their start date, trying to calculate increments in pay, whether it's pay award or inflation or any of that sort of stuff, was happening around the anniversary rather than a set time in the month. We also had the forecasting for monitoring of short-term and multi-year projects. So, as you know, public sector is getting a lot of funding cuts, so a lot of projects are around cost savings and what can they do to kind of monitor and report on those and follow those through. And then we've got some standard everywhere where they're managing offline spreadsheets and not moved on to these kind of systems where there's a lot of effort required in consolidated feed from multiple different users or different people in the organization, looking at different versions of the truth, and also kind of every department or every person who's doing a forecast might be doing it slightly different. So there's no real consistency on how that forecast is being put together. And those are some of the key challenges we wanted to address. So we looked at their offline models, and this doesn't really do it justice. There were some really sophisticated models that they had in Access and spreadsheets and things like that to calculate some of these. And then we broke it down, redesigned it, and made it sexy. And then we had the NHS template born from that. Yeah. So just to give you an idea, it was kind of taking all of those components that I was talking about before. So they had a detailed income. So we created that detailed income model. We created the pay model with all of their business requirements and a central main database that stored and consolidated all of that data and put it together for the reporting requirements. So that was an application, a full application that we then took to those organizations. And also, really, we'd set it out and configured it using user variables. A lot of the challenges, organizations, especially public sector, seems to have really big structures, right? And people want to work at different levels within those. So using things like user variables allowed us to take the same thing to different organizations and let the users pick the level that they want to work at. And then the model had to be based around substitution variables, right? Because what we want to be able to do is take this and deploy to another organization without hard coding anything in there. There's got to be absolutely no hard coding, simply because of the way that this was going to be deployed to other organizations. And then because it is kind of systematic, you can actually create instructions for anybody in the team to be able to kind of deploy that. The exceptions to obviously these deployments are things like data and structures, which you have to load in for that organization, the integrations for any other systems, the security, and obviously any gaps that you might have. So you've got a base application that fulfills core requirements around that organization, but there might be additional changes, additional reports that they want, or some integrations, interfaces that they want to feed into that. And then we were able to deploy that within 30 elapsed days. So that's not 30 days of manual effort. That's 30 days end-to-end from the time that you go in, you do a gap analysis, you work through the template, see the bits that don't actually fit within the organization. Deploying it is as simple as deploy the snapshot, because you've already got the application, load the structures and data, add in the security and integration specific for that organization, and then you can reduce things like UAT time, because you have already got a template that's been tested, right? What you're testing is the structures, the security, and the integrations for those guys. And then you can have training and video documentation and training materials already prepared. So there's no requirement of that. And then it's just a handover to the system administrator. So you can actually deploy that pretty quickly. And we proved that by delivering it to North Cumbria, NHS Trust, Taunton, Somerset, NHS Trust within 30 days of going in, deploy it, and we were out there. And then working with some of the local government, they've got the same principle. The difference is around the income, so the funding requirements are a little bit different, how the councils get that funding. But, you know, Croydon Council, so here when I say 30 days, I'm talking about comprehensive application, because Croydon Council, I was able to deliver in 15 days, and that was just 4 forms, right? That met their business requirements. But that more complex application is something that takes 6 to 9 months to deliver, usually. North Yorkshire County Council, by the time we'd got these, we had a template that we would then deploy to Northumberland County Council within that 30 days. And now, for my sins, I'm working in central government. Right, so at the Home Office, and this is on a mass scale. They're trying to move everything to the cloud, right? So they're looking at all of their PBCS, HCM, they're moving all of it, and it's a kind of it's a pathway for all other government departments as well. So if they can move to the cloud, It's not going to be a 30-day implementation template or anything, but it's in a very similar fashion. They can take what they've got from there and try and move that across to other government departments and save the time and effort and the cost. And that's it from me. Thank you. Is there any questions?
Thank you. Any questions about the template? Okay, cool.
Yeah, get off.
Okay. Thanks very much. Yeah. Cool. So.